guys, we're going to continue what we already started. We're going to carry on the intro, how we're going to have a good start in this SimMan scenario. So in the last video, we discussed about how to go and start your station. Like, your first thing, you need to go inside. Just to repeat what we already discussed, you need to go inside and you need to say that, okay, I can see my patient attached to the monitor and assume I've taken all the universal safety measures. After that, you go and introduce yourself. Here's the first point we'll start. So introduce yourself. Hello, this is Dr. Ever. I'm one of the GE doctors working here. After that, you need to confirm this identity, the patient identity. So how to confirm the patient identity? So you need to confirm three important things. What are they? First thing is the name, the patient name. So to do this in a SimMan scenario, it's different from the other scenarios. So you need to narrate and paraphrase the name of the patient. So, are you John Smith? And instead of going inside and saying, can you please confirm your name and age? Because the patient will be critically ill patient. He will not be having this effort to go and give his name to you. So you need to just say it and he will confirm this. So, are you John Smith? This is the first thing, the name. Now, the age, are you 45 years old, for example? Now, what else? The name preference. Can I call you Joe? So here what you're doing, you're confirming three important things about the identity of the patient: the name, the age, and the name preference. How you're doing this? By narrating that. So are you John Smith? Are you? Yeah. So after checking the name, the age, name preference, so this is the second point, which is confirming the identity. The third point is acknowledging, then saying sorry. Then the point number 4 or point number 5, which is really important here, is to reassure. So yeah, John, acknowledge first. I can see that you have difficulty breathing. I'm really sorry for that, John, but I'm here for you. This is how we're gonna reassure. So first thing, introduce. Second thing is confirm the patient identity. I told you how to do this by 3 steps. And after that, acknowledge, say sorry, and then reassure. These are the 5 points. Now there are 3 remaining points. Now point number 6, which is really important, is calling for help. Now, whenever you have an unstable patient, critically ill patient in the hospitals, in any place in the hospital, in the A&E department or in your department, whatever the department will be, you need to call your seniors. So how are you gonna do this in the SimMan? How to gonna show the examiner that, okay, you understand that when should we call for help? Here is the point number 6. So when you go here, when you see the patient is having shortness of breath, you acknowledge, you say sorry, you reassure him. But John, first of all, I would like to call for help. Then after that, after calling for help, you need to put the initial measures. Now, what are the initial measures after I would like to call for help? If patient is having shortness of breath, you put him in a semi-sitting position. This is the initial measures. If patient is vomiting blood or vomiting generally, you put him in a left lateral position or recovery position. Now, if the patient is, for example, having anaphylaxis and you can see he's connected to some blood and fluid, what should you do? You should disconnect everything connected to the patient. These things are considered as initial measures. We already did a video about this, and you need to do this before you starting the A to E protocol. So this is point number 7, which is really important, which is the initial measures. So this is all for today. So the next video we are going to discuss the last point, which is point number 8. I'm gonna give you a brief about how to go and do all of them in one sentence or one go, so you can have a very good introduction and a very good intro and start in the SimMan scenarios, which will actually push you to do very good in the remaining steps of the station and the scenario. So thank you so much for today. Guys, if you're happy with this, if you have any comments, please drop the comments down. We'll be reading the comments and replying with that. Thank you so much. See you.